Now I would like to say a few words about the Global Working Group on HIA that I'm co-sharing with Fiona. This working group is one of the 7 working groups of the IUHPE. The mission of this group is to support the development of HIA as an approach, practice, and process. The group objectives include to enable discussions, debate, and share learning among researchers, practitioners, policymakers, and communities engaged in health and other forms of impact assessment in order to develop a research practice policy agenda for advancing HIA. We currently have 16 members from different parts of the world, and we also have a Francophone subgroup that's aimed at enabling practitioners and researchers from Francophone countries to exchange on HIA. Today, our sub-plenary session is planned for 1.5 hours. I hope that we will be getting a lot of questions and comments from the audience. And also please note that if you have specific questions for one of panelists, thank you to indicate your email address in the space for questions that we can send the question to the appropriate persons. And I think that is enough for me right now. But at this stage, I'm going to hand over to Marianne Jacques. And Marianne, over to you. Thank you.
Merci beaucoup, Thierno. Bonjour à tous. Hello, everyone. My name is Marianne Jacques. I'm a scientific advisor at the National Collaborating Center for Healthy Public Policy, and I'm also the coordinator for the Global Network for Health in All Policies. Before going further, I would like to acknowledge that I'm located in Canada, in Montreal City, an Indigenous territory and the site of the signing of the Great Peace Treaty. So I want to take this opportunity to thank the Mohawk Nation for their hospitality on this unceded territory. The Global Network for Health in All Policies is a country-led initiative that was launched by the governments of Sudan, Finland, Quebec, Thailand, and South Australia at a side event during the 2017 World Health Assembly. The Global Network has been established as a platform for strengthening and advancing health and all policy implementation. Our aim is to support skill development, capacity building, and knowledge sharing around health in all policies to address the social determinants of health and equity. The Global Network wanted to take the opportunity of this global conference to reflect on the lessons that the COVID-19 pandemic has brought to multi-sectoral collaboration. And this is why we were very happy to partner with the Global Working Group on Health Impact Assessment and the REFIPS to bring you this session. This pandemic provided both opportunities and challenges for working across sectors. Here in Canada, during the acute stage of the pandemic response, we witnessed unprecedented multi-sectoral collaboration at the federal, provincial, and local levels to implement protection measures, but also measures such as subsidizing businesses and wages, implementing measures to address food security, specific responses to vulnerable population, to address the social determinants of health affected by the pandemic. And so as we move to a new normal, the temptation to revert to working in silos is strong, but the challenges that this pandemic has left behind in terms of inequalities and associated health outcomes requires government around the globe to work across sectors and implement innovative and sustainable solutions to foster health and well-being for all. So without further ado, I will hand it over to my colleagues via video to hear their experiences around the pandemic response and the lessons learned for implementing multi-sectoral collaboration to address health equity and the social determinants of health. Don't forget, if you have any questions, please use the question section to submit those questions. And if you have specific questions for the panelists, make sure to include your email address along with your questions so that we can provide you with an answer by email. So, merci beaucoup. Thank you, and see you after the panel discussion.
Thank you, Marianne and Thierno, for introducing our sub-plenary session and setting the scene so well. We're really excited to be with all of you today. And so we want to welcome you to the pre-recorded section of the Improving Governance for Health. Can COVID-19 provide lessons for working across sectoral boundaries? Sub-plenary session. This session has been jointly convened by the Global Network for Health and Policies and the IUPE Global Working Group on Health Impact Assessment. My name is Carmel Williams, and I'm an Associate Professor and Director of the Centre for Health and Policies Research Translation. And along with my colleague, Marianne Jacques, I'm a member of the Global Network for Health and Policies Executive Committee and Leadership Team. My colleague, Associate Professor Fiona Haigh and Dr. Thierno Diallo are co-chairs of the IUPE Global Working Group on Health Impact Assessment. Our two groups have combined efforts to plan and deliver today's sub-plenary session. Both the Global Network on Health and Policies and the Global Working Group on HIA are committed to promoting action on the underlying determinants of health and wellbeing and health equity through working across sectors. Multi-sectorial approaches such as health policies and health impact assessment aim to influence the policy and practice decisions of governments in ways that optimise health and health equity outcomes. Working across sectors is challenging and for most governments, not a natural part of their business practice. It requires specific efforts to break through sectoral boundaries and silos. COVID-19 provides a useful snapshot of how governments can rally ministries to collaborate and break through their silos to achieve whole of government and whole of society outcomes. We are really fortunate to have four highly regarded senior policymakers with us today, and the sub-plenary session will invite them to reflect on their experiences of working across sectors during the COVID-19 pandemic, and to ask, what can we learn from these experiences that can support further action on the determinants of health and health equity through multi-sectorial approaches, such as health and policies and HIA. We are also delighted to have two leading public health experts with us today to provide their perspectives and insights on the panel's discussion. Now I'll hand over to my colleague, Associate Professor Fiona Haigh, who will introduce our speakers and curate the panel discussion and the reflection from our two rapporteurs. Over to you, Fiona.
Hello, everyone. So yeah, my name is Fiona Haigh. I'm the Director of the Health Equity Research Development Unit, which is a partnership between the University of New South Wales and Sydney Local Health District. And together with Thierno Diallo, I'm the co-chair of the IUPE Global Working Group on HIA. Before we get started with the panel, I'd just like to acknowledge all the traditional owners of all the lands that we're meeting on today. We're all joining from different places in the world and different time zones. So I'd just like to acknowledge the traditional owners of all of those lands, elders past and present. So today I'm in New Zealand, back home in Aotearoa, and I'm on Tainui land today. So now what we're going to do is go around our panel and our rapporteurs, and I'm going to ask each of you to just briefly introduce yourselves. So I'll start with Taru. Can you just introduce yourself for us?
Oh, hello, everyone. My name is Taru, and I work as a director in the unit for communities and functional ability. And I have been working there for a long time and have now this is one of the issues which have been part of my work for decades. So it's a pleasure to be part of this session. Thank you.
Thank you. Nanuj.
Hi everyone. I work at the National Health Commission Office and as a global collaboration unit. And I've been involved with health in all policy through my work and also joined the Global Network for Health in All Policies since the start.
Great, thanks. David.
Hi everyone, I'm David Houeto from Benin, West Africa, and I'm an associate professor at the University of Parakou. I'm also sharing the International Francophone Network for Health Promotion called REFIPS, working with the region here with many countries to put health in all policies and let people know how useful it is to work together with all non-health sectors. So we are in this regard leading actually a course, a regional course that involves many countries, about 30 countries speaking French around the world. Thank you.
Great. Thanks, David. Ariel.
Yeah. Hi, everyone. Well, I'm Ariel from the American region. I have for the regional advisor in social determinant of health in Pan American Health Organization of Houeto. This is part for the unit of health promotion and social determinant in Department of time with previous in the government in Chile, in South America, in the public health, in the chief of the cabinet, and work long time for intersectoral work and equity and social determinant, and also some time more for the academic, no, in the University of Chile in public health school. Thanks.
Thank you. So that's our panel, but we've also got two rapporteurs who are going to, after our panel session, they're going to reflect on what they've heard during the panel and also bring in their own experiences. So Vivian, would you please introduce yourself?
Thank you very much, and good morning, evening, afternoon, wherever you are to everyone. I'm Vivian Lin, presently the Executive Associate Dean and Professor of Public Health Practice at the Faculty of Medicine at University of Hong Kong, previously having worked at state and federal levels of government in Australia, as well as being a director in the Western Pacific region of the WHO.
Okay, thanks. And over to you, Liz.
Hi, I'm Liz Green. I'm consultant in public health, policy and international health at Public Health Wales, which is the National Public Health Institute for Wales. And I'm also a director of the Wales Health Impact Assessment Support Unit, and we use HIA in Wales as a key vehicle through which to drive health and all policies.
Great, thanks. So now we're going to get started with our panel session. And as I mentioned earlier, although we've got some prepared prompt questions, we're hoping that our panel will, and also our rapporteurs will engage in a conversation with us. So please feel free to comment, reflect, and ask questions of each other. Don't hold back. So we're going to start though, first of all, by going around each of our panelists and giving you a couple of minutes to just tell us about what you've learned about multi-sectoral approaches from your experiences during the pandemic. You know, what has it been about COVID that's, you know, maybe enabled things different to work in different ways? What's happened that's different than usual, and what have you learned? So we'll start off with Tara.
Thank you so much. We talked about the history of health and all policies in Finland. So we already had in place very much structures, processes, and ways to work together. But however, there have been a lot of years. In such, Finland has succeeded rather well compared to many other European countries. Mortality, morbidity has been rather slow, low, and we haven't used so much restrictions than other countries. And somehow health has now got a lot of more visibility, importance. It's a priority, which has been very much an opportunity for us. And especially because the consequences of this pandemic has been for all sectors, all different age groups, and so it's the whole society which is influenced by that, and because of that, health has been so much visible. And there have been a lot of such developments already going on before the pandemics, which are now being faster and more visible. And that's usually the positive way. I want to mention one new concept, the economy of well-being approach, which in a way is for us a continuum for health and all policies. We have used this opportunity to promote this approach during a pandemic. And so it's like a continuum of promoting health and well-being on based of health in all policies approach. And we believe that this economy of well-being approach is making it possible to both protect the vulnerable and also functioning of economy and the society. And we focus especially between links between well-being and economy to make sure that we are not just making quick fixes on immediate problems, but take the opportunity to build better, more equal and inclusive systems of the future. So we highlight the role of investments on health, education and skills, social protection and gender equality for sustainable social, economic and environmental development. So we think that multi-sectoral responses to COVID-19 had the same underlying principles and challenges which have in health in all policies. We know the successful factors which we need, and we have used it already almost now in implementation. We need structures, processes for systematic cooperation. We need political leadership. We need common goals. So win-win situations. We need competence and access to data. We need resources. And these are also factors which have been essential in multi-sectoral responses to COVID-19. So all sectors have a role in the recovery from COVID-19 pandemic. We have found it very important. In many cases, we are not talking about health agendas, but joint agendas. For example, how to get people to the labor market, how to keep them there, or how to promote the functioning of schools and education. So what we have during the pandemic situation found that there are very good examples of examples how to work together and what ways, very practical ways, promote this health in all policies, multi-sector approach. We need communication which is common to all the sectors. We need common data. We need also use effectively them. So we need also new ways, innovative ways to work, and pandemic have promoted this. So so that it's not just one sector working alone, but working together, finding very practical solutions for problems. And then we especially have found out that mental health is such an issue which on which we need and have found new ways to work together, because mental health is such an important factor for the resilience of a whole society. And so, in short, base all the activities on already existing resources, existing methods, structures, and use them, and if necessary, create some new ways to work. So, in short, synergy, policy coherence, and more effective use of resources. So that's our finding of these 2 years. It has been an opportunity to create visibility and more, how to say, importance for the health as a health of a population. Thank you.
Great, thanks, Taru. Now, Nooch, over to you.
What I learned from the COVID-19 is a lot. And I have to give you a bit of background of my work on health in all policy in Thailand. I'm working at the National Health Commission Office, which is under the Office of Prime Minister. And we have the National Health Commission chaired by the Prime Minister. This commission is mandated to give advice to the cabinet. And the advice comes from the resolution of the National Health Assembly, which is a multi-sectoral platform that government sectors, academia, NGOs, civil society, private sector meet and discuss and come up with the suggested solutions for the government. But honestly, during the COVID-19, what we learned is that even though we have multi-sectoral mechanism, but is because the nature of acute of the pandemic, this kind of mechanism perhaps doesn't work because it's too formal, and we need, and it's too formal and move not that fast as we supposed to. So what we learned is that we organize a network with 20 organizations, definitely multi-sectoral groups. And we work more, try to close the gaps of COVID-19 management, instead exchange information quickly, work during the nighttime as well, like that. And that is quite suitable for this kind of situation like VUCA world indeed. So this is what we learned from COVID-19. That's it by now.
Great, thanks, Nanu. David, tell us about your experiences. What have you learned?
Let me start by saying that at that period of time, I was deployed by Houeto to Senegal, and come and see how it is for the health sector to work together with all non-health sectors, such as the local government, the other government sectors, and every morning all getting together to get fix an objective and distributed how each sector can go about it in order for all the group to reach the objective. It was something amazing for me, because my first time to see that in the region, people can understand that health is not something which can be just for the health sector. And I think that for them, it was systematically what they could do. And I can't say actually that from that experience, they've really understood the necessity to work together with all sectors. And that's why actually I'm on my way going back there to do what you know, action. After the action, we'll have assessment to know what actually people gained from that experience. So I can say more in few days coming about what is on the ground actually, mainly from the health sector part, because there this sector, the health sector, was leading all the activities back there, and come to see them actually calling upon everyone, sectors, communication, environment, security, and the advocacy part from everywhere to, because, you know, in Senegal, there is a little bit a religious aspect. So you have to liaise with religious leaders, and otherwise people cannot hear what you are saying. Then you see the top management from government come down to local policymakers and religious leaders in the city they call Touba, the center of Islam in the region, in the country. So the top management from the government come down and discuss with these notable. It was something amazing for me. So I wanted to know actually whether there is still something on the ground, because actually we are decreasing in the COVID-19 situation, emergency. So I just, I'm on my way actually going there to assess the after the intervention, what is on the ground. That's what I can say from now. Over to you. Thank you.
Thanks, David. Ariel.
Thank you. Well, Well, our learning about the COVID pandemic, this is something come from we developed some case study in the region from the different level, for the local level, for the national government, also for the city. And we try to identify what is the common of them and what happened in the region. And the first is that the pandemic and the emergency was very different than other before, because this is a long time. This is the process was long, and we need to different strategy and change for the structure for the intersectoral work to respond for the different demand, and we need the fast, and many times the previous experience, the multisectoral action is slowly, we need to commitment, and here is very quickly, and sometimes the structure not necessarily respond at the speed that we need, and in some of them create new structure for the intersectoral work, some and another reinforce the structure before that they have. In some of them, we were close for the emergent structure, but another not necessary, is more close for the social cabinet to put the agenda. And in the general, maybe we had it as three points for the learning. The first is we can see or reinforce the relation for the social condition and health. It was clear that we want to discuss the underlying social condition impacting health, but now we saw the health impact in the economy, political and social environment, and this was very clear when we discussed the base of the social in health, And the second, I think, relation for them is also the balance or the tension between economy and health, Many times the discussion is we need economic growth or to give healthy population, but now we saw that we need health if we want to economy, and this is also something space for to discuss some new arrangement on the social contract that what happened in our region, because in some of them, the impact on the social and economy of the pandemic create a lot of the instability on the political environment and also mobilization for the people need. And the third point for us is very important that the local government, the territorial, the local is the more flexibility, capacity to respond more quickly for the need population. And really this has happened that the operation of the multisectoral work, the intersectoral work happen in the local level, And for us is the other point, Increase on strength for the local government multisectoral work if we want to address and respond in the correct way, the pandemic and the other emergency. That's it.
Great. You can sort of see some common themes emerging from everyone's sort of stories about, we've got having to do things in a fast way, in a slightly different way than before, but then also at the same time drawing on those resources and ways of working that you had previously, and the links with the economic, with the well-being. And so just sticking with you for Oriel, just for a moment, you were talking about the sort of the social determinants of health and those underlying conditions suddenly becoming a lot more present, and particularly seeing how they relate then to the kind of economic and sort of political sphere. We've also heard the pandemic, described as a syndemic, where we've got these pre-existing determinants of health inequities that are interacting with the pandemic. And I think we've all really seen through the pandemic how it's disproportionately affected certain groups, and it's kind of revealed the things that probably all of us in our normal working lives, this is our bread and butter, but it's suddenly become something that's kind of everyone's talking about and everyone's interested in. And when we think about multi-sectorial actions, like particularly things such as health impact assessment and health and all policies, they have a clear goal and mandate around addressing health inequities. So thinking about your experiences and those case studies, how do you think those multi-sectoral action sort of areas of action have been able to respond, particularly around health inequities?
Thanks. Well, I think that in our region we have this is one of the regions, the big inequality in the world, and for example, we have a high percent for the people working in informal worker. We have not social protection coverage. We are not stability for the income. And also we have in the process of pandemic, a big problem about the migrant process and also for the informal settlement, three aspects that is crucial for response for pandemic. No? And some of them that we have to be very clear that when we have to implement for the non-pharmacological measurement public health, we need some social condition for to apply the lockdown or the people staying home, because if the people not have income, it's impossible to respond of them. And this was mandatory of the government to promote some program to give support in the social protection, the income, food, the population, if we want to advance for the response for pandemic, no? And for us was very clear the demand relation for the social, for the labor and social right for the informal worker and migrant, and also for the social protection income to respond for pandemic. And this was demand immediately, but the sector is very open to discuss before and listen to help, because this is demand, no? And this was a big opportunity, no? But to really to address equity, because when we talk about many times equity in relation for multi-sectoral work, in our region, sometimes the people more focused on the vulnerable group or poor people. And this is useful, not the strategy for poor, but not necessarily reduces inequality. And when really we have to include more policy for social transformation, we have to address equity. And the pandemic was opportunity to put visibility about of this and to put pressure to address this aspect.
Great, thanks. Does anyone else from the panel want to also respond to that question around the tools and tactics of multi-sectoral action and how you've been able to use them, particularly in relation to inequities?
It's quite a difficult question, but I can give an example on migrant workers' situation during COVID-19 in Thailand. We have both documented and undocumented migrants, plus their dependents, and mostly they work at the construction site, cloth industry, and food industries. Around 600 migrants were laid off, and 2% of those migrants were laid off without compensation. Some migrants were not laid off, but were forced to have unpaid leave instead. And around 500,000 migrants have disappeared from health insurance, because health insurance of migrants are related with employment. And in 2020, migrant workers were not classified as the high-risk group in Thailand. So we didn't do active case finding to migrants, although their housing and living condition is poor and congested. And this is why in December 2020, we had a cluster of migrant workers at the Central Seafood Market, and from that it spread around the country. And some of migrants have health insurance, but they don't know their rights. Some know their rights, but never exercise due to unfriendly health service, a language barrier, and discrimination. And moreover, there are lots of migrant workers who have no health insurance because they are undocumented. And during COVID-19, even though the government issued a policy in April 2021 that migrant workers would be screened and receive COVID-19 treatment at no cost, and this is applicable for both documented and undocumented workers. However, in practice, migrants have still found difficult to access to healthcare. And the problems of migrant health is that there is no law for migrant health. It is only the cabinet resolution. During COVID-19, the government used the Communicable Disease Act and Royal Decree for Emergency Situation to prevent and control the pandemic, and both laws cover the public in general, but not the migrants. And the lack of legal powers related to access to health insurance for non-Thai people, especially migrants, and causing problems and obstacles in the crisis management and equity of access to health services in terms of COVID. So what we do is to organize the National Health Assembly in 2021 on the issue of equitable access to health services by vulnerable populations in crisis. And the vulnerable populations include migrants, inmates, slum people, homeless, LGBTQ, the elderly, people with disabilities, and so on. So we raise up this issue in public and discuss on how to solve this problem. And in June this year, we are going to have the Health Assembly on rights to health of migrant workers. Simply, we want to have Migrant Health Act. Driving this issue is compulsory to work with Ministry of Labor, Ministry of Interior, Ministry of Public Health, Ministry of Finance, and NGOs, which work for migrants. And this is not a short-term response to health inequities, but working on resolution is a long-term response. And back to about the COVID-19, definitely we have short-term response to health inequity, like to make them migrant, especially undocumented migrant, back to the system, go to access to healthcare. But this is not enough, really. We need to solve it in a long term.
Yeah. That's great. That's interesting, because it sort of sounded to me as if, you know, when you were talking earlier, you were sort of saying how your traditional responses weren't fast enough, but then for something that an issue as big and complicated as this, it sounds like you are going back to your sort of more traditional way of responding in terms of having the assembly, considering it over a longer period of time. Yeah. Did anyone else want to comment on that? I think, Tara, you looked before like you were about to say something.
Yes, thank you. So equity in health has been one of the priorities in Finland for a long time, and we have a government resolution already for some years ago, which is emphasizing the practical implementation of activities to tackle this problem. And it's not only health sector; it's the whole government behind that. And somehow this situation, which also in Finland have raised the problems or visibility of differences between population groups and also regional differences, it has created more, how to say, support for activities which already have before this situation have been decided, so that it has make it more visible, it has given more support for activities, and also new solutions have been tried to find there. And especially the whole government, the other sectors are now more how to say, they know their role, and also they know also what influence these differences have in their activities. And that's somehow, we haven't created very much new, but are proceeding better with what already have been decided earlier. And there's one issue, there will be an expert working group launched in near future to look at the situation. What data we have about the developments during these pandemics, and what else should be done in the future. But I think the most important lesson is that this unfortunate situation have supported our activities, which we in health sector have tried sometimes alone to forward. But now we get all on board, because everyone else on different sectors also understand that they are not able to, for example, get young people, their learning results are not so good if they are not at school, and not their mental health is supported, or employment sector. They really suffer now about the lack of resources, lack of people, and also problems because people are having more and more problems with health, etc. And but also in Finland, even though we have this government resolution and practical activities already before, the differences have been increasing rather highly. And especially the groups which have been vulnerable are now suffering more and more, even though we have known that situation. So that's a lesson for us. We haven't been effective enough to support or take these approaches up with others. So we have a good basis, but a lot to do, as all of us.
Yeah, thanks. David, did you want to add anything to that?
Oh yes, I can say that with this COVID-19 situation, it was something, okay, an emergency situation, which is not what we want all the time, but it was now an opportunity for people to learn more about how the health system should be working together with other sectors, non-health sectors, to address the social determinant of health, because we saw at that time that people actually they was conscious for the fact that okay, we cannot go for lockdown that way without thinking of what people will be gaining or eating, or the daily life. So it was something actually that helps the system to understand that okay, health goes beyond the hospitals and all the structures down there to only be focusing on diseases. And I think it was unfortunate, the COVID-19 situation, but also let's say that okay, with that we can have actually some situations forward, looking for other sectors in solving health issues. Thank you. Over to you.
Yeah, thanks, David. So we've heard about how COVID in some ways has actually enabled us to do some things slightly differently, and we've learned some things. But as we kind of return to whatever our new normal is, we've also been talking about how it's this opportunity to rather than just returning to normal, to continue to do things differently and maybe to do things better. I'd like to hear from you all just really quickly. How do you think we can maintain what we've learnt when we don't have that driver of the pandemic behind us? So who would like to go first? Russ, I'm going to pick someone. David.
David, yes. I think from my part here in the region, to maintain what we gained from that situation of COVID-19, we do need to add, let's say, training because in my region, the specificity is that people really don't know all about what it is to address social determinant of health, because from the health sector, they are just still in that way of thinking just of diseases when it comes to talk about health. So actually, I think to maintain what we've gained, it will be better to reinforce what they should be knowing about the health system itself, because we used to say that to them at that time that you see now, the first thing you as health system must be doing, it's to coordinate all the other sectors' intervention so that, by doing what they are doing, they don't harm the health of population. I think we need to reinforce all this through training and let them know all about health promotion and addressing social determinant of health. Thank you. Over to you.
Yeah, great. Thanks, David. Nanuj, would you like to?
May I continue? Oh, sorry.
Yeah, sure. Nanuj and then Tara.
All right. I totally agree with Fiona that COVID-19 is not the last, and it's not the first crisis either, and every time that we have crisis, it's just the echo of importance of multi-sectoral decision making. But when we back to normal stage, we also back to the working culture that we keep doing it. But I think to keep this spirit sustained, I'm thinking of 3 to 4 things. One is the structure of governance mechanism, which whether or not it is include various sectors, including NGOs or people sector. The second one is laws and legal measures, things like that, that to make things, the governance institutionalized. And the third thing is we need evidence, strong evidence from scientific views and public opinions to inform decision makers. And the last one is a culture of collaboration. Even though we have number 1, number 2, number 3 that I mentioned, but the decision makers not value the culture of collaboration. It's not doable anyway. And when I'm talking this kind of culture, it's not just at the decision-making level, but also implementation level. And all these things cannot happen after COVID, after the crisis. We have to invest in it long before the crisis. And if you look back to countries that can back to normal quickly, I think they have all these 4 things before the crisis. That's just from me. Over to you.
Thanks, Taru.
If I may continue, it's very easy to agree with all, but not just took up. So it's very much also experience from Finland that these are the factors we need. And I think it's now wise to use the opportunity while we now are visible and now respected and understood why health is so important. Use the opportunity to launch or to make it permanent structures of governance, permanent way to collect data and use it for common purposes, to have all these processes and everything, so which is now working and which have been useful in the pandemic situation, to make it permanent, so that it stays and it will be used in the future as well to have the high visibility for health issues. And there, as Fiona said, it's very useful to have a legislation base for that, to put all this in some laws if it's possible. So it's not so easy to put it aside if it's by law, the duty of different sectors, and have very good cooperation, not just all the sectors, but as you said, also NGOs. It has been very valuable in Finland, for example. They are so quickly taking the role with new innovative ways to support the people. And if we, the government and official side, support their activities there, we can create much more better situation for the people. So really echo what Nanette said. We need common data. We need common understanding about the issues. We need permanent structures and processes, and by that create the engagement and how to say, the political support for activities. Use the opportunity. Yeah.
Thanks, Taru. Ariel.
Yeah. Well, I think that this is a crucial point now, because this will have to maintain that the advance that we have during pandemic in intersectoral work. We need to give sustainability in this process. And many times we discuss the structure, resource, budget, choice space, and this is from us is not enough. I think that if we have really maintained the structure that the state created from the pandemic, we need to now think what is the problem common that the different sector has post-pandemic. And probably it's not the health in the center, and this is something that we need to help understand, not necessarily leader the process in this time, And for us, for example, in our region, we have increased for unemployment in important point, And maybe we have said, okay, what we need to do for the health sector to address unemployment, relation for mental health, and to try to address the agenda in the other common problem that different sectors have responded post-pandemic COVID, Because we have a crisis for political economy in the different countries after pandemic, and what is the contribution of health about of this? I think this is something that we need to open mind about address the problem, because probably the people not necessarily putting the health in the center again in the next period, Thanks.
Okay, now we're going to move on to our rapporteurs. So We'd like to hear from each of you, your reflections on what you've heard, but also bringing in your own experiences. So we'll start with Vivian.
Thank you so much. And thank you to all the panelists for such interesting discussion. I must say that, as I look around the world over the last 2 years, I think that one of the biggest common lessons across the world is the way COVID reveals all the weaknesses and some of the positives in health governance. I think that's the one biggest thing. We see so many issues, there are so many lessons. And unfortunately, I would say, despite positive experiences of many countries that we can point to, and countries that adapted their experiences over time as the science unfolded, generally speaking, I don't think the track record is very good. So this really does pose a big issue about, how are we going to do better in the future? But I want to reflect on the comments from the panelists in 3 ways. The first, I think, is what might be some of the lessons from the health and all policies structures that are in place. And I think the first thing is that having that foundation helps a lot. And that's really important to recognize. And I think there's a second point that I found really interesting, which is recognizing that cities are actually at the forefront. There's an immediacy about responding to people's needs and their lives. So when we come to really close to that community level, the intersectoral collaboration happens out of necessity much more. And I think that's a lesson for how we want to work in the future. And I think that relates to one of the perhaps negatives is that, the structures that have been in place have been seen to be slow, formal, not responsive. So new governance arrangements had to be invented. So maybe there's a lesson there. But I think the other lesson is despite all the talk and work through health and all policies on equity, it's still forgotten in the process of COVID. And that has to do with equity still is not front and center, and particularly the legal frameworks aren't there. So the health and all policy has relied on goodwill, has relied on political backing, but it has yet to be truly institutionalized. So how do we move forward? So the second thing I think is that I think COVID did build some new foundations. One is that in the past, health sector people had to go tell everybody else how they are an important determinant of health. But now other sectors realize that the health sector is actually an important determinant of their own functioning. So now we have an understanding in the other direction, and that's an incredibly important foundation. I think the second element of that new foundation is every single of us on this planet has been affected. So suddenly the interest in health issues and the understanding is so much greater than before. So how do we work with that and bring the community and everyone's interest into a better understanding of how we move forward? So then the third issue becomes, okay, what does this mean for recovery if we think about at least coming out and managing some way? Well, I think one of the important issues is, can we be framing in a different way? And the whole notion of well-being might be a very good way to go forward. That's a much more inclusive language than health in all policies, which does smack a little bit of health imperialism. And of course, the Geneva Charter on Societal Wellbeing provides just another tool that we can work with alongside the economy of well-being. But to move forward, I think being agile and being practical are some of the real lessons. You know, focus on problem solving and delivering the goods is really important. But that pragmatism should not be done at the neglect of the policy foundations that have been built. So issues like social protection, issues like universal basic income, or even in many countries where there's no progressive taxation system. So there's still a lot to be done, let alone the legal guarantees that provide the assurances. So I think part of the framing moving forward is about what does preparedness look like for the next pandemic? You know, everyone except this is not going to be the last one. So preparedness has to make sure that we don't see the same kind of inequities that we have seen this time. This will be the true test of good governance, and that we can reflect the voices and the needs of vulnerable populations and not put people through what they've been through in the last 2 years. And I think that will be the real test of whether we have succeeded. So let me leave my comments there.
Thanks. Liz, over to you.
Yes, well, thank you for your interesting contributions, and a lot of what you said really resonated with me, and the experience of Wales particularly. So the descriptions of using what we already had, building on them to foster multi-sectoral action, looking at inequalities, the pandemic exposing inequalities issues that were already in existence. All that is coming through, and the way to adapt and create new ways of working. But one thing that I didn't hear is actually the use of tools and approaches such as health impact assessment. So forgive me, but I'll put my HIA hat on for a moment, because health impact assessment and participatory, collaboratively way of working was used in Wales to, going back to what Nanut said, to engage with the key stakeholders, utilise sort of governmental structures and the way things have been institutionalised in Wales, but also provide information and evidence for decision makers. And in Wales, Public Health Wales carried out, with a range of public bodies, including Welsh Government and local authorities or local governments, to carry out health impact assessments on lockdown and the impact that that had on all the population, and particularly who were those who were most vulnerable to the situation. So you talked about those on low incomes and those who are in precarious employment or housing. Then we've got a health impact assessment on new ways of working, such as home working and digital working and digital health and healthcare, and the way that has panned out. And also captured, well, what was positive about it, but what was negative, what were those unintended negatives. And it's helped inform Welsh Government and a range of bodies around, well, this is what the impact has been, this is what you might need to think about doing. And so, for example, the home working health impact assessment has been used by Welsh Government as part of their remote working policy going forward. But also I'm hearing about how we need to rethink the way forward, putting health at the centre, but also in balance with society, the environment and the economy. And that economies of well-being work that you talked about, Thierno, that is also happening in Wales, about us rethinking well-being that you said, Vivian. But the other thing that that you've all kind of talked about is the need for governance and legislation and acts. And in Wales, we have that, a very collaborative act called the Wellbeing of the Future Generations Act, that makes public bodies work together to strive for a number of goals that include prosperity for all, that includes health and equity and a better environment, a more resilient environment for everybody. So for me, what you've said kind of resonated, but also made me think about our context as well. I think you're also all right. We still got a long way to go, and we have to look at other challenges we're facing, such as climate change, and how that may have a cumulative impact on what we're doing as well.
Great, thanks, Liz. So I'm going to hand back to Carmel now.
Well, what a fascinating conversation. I've really enjoyed listening to all of the insightful comments from all of the speakers. And so I want to thank you for your contributions, both the excellent panelists and the insightful rapporteurs. And also I want to acknowledge Fiona's did a great job of curating the conversation and allowed me to do a little bit of time management. And we're nearly at 60 minutes, so we've done a pretty good job. So today's discussions really highlighted the many and varied experiences that COVID-19 has provided, and it's sort of how this has really driven collaboration across sectors. I think it also really, what I found interesting was there was some commonality that I wasn't expecting to see, and I wasn't expecting to hear that even though a number of jurisdictions and countries had mechanisms in place, that actually those mechanisms weren't responsive enough to the acute decision-making requirements that COVID-19 drove. But they probably did, as Vivian and I think Nanut and Taru both mentioned, they did provide a foundation on which to build and to establish new mechanisms, which is obviously important that we build on and don't lose. I think there are many lessons that we can draw from, but I suppose what I've also heard is that the nature of multi-sector collaborations that occurred during COVID-19 was really driven by the acute nature and of the pandemic itself, and the slow burn nature of determinants of health and health equity don't necessarily provide us with the same kind of imperatives and drive for government decision makings. And so I guess the question I'm posing is, how do we build on the foundations that COVID-19 has provided to try and embed some of those, I guess what I understood as to be more informal, perhaps in some circumstances, governance responses, and not lose the ground that we've made. And the Global Network for Health and Policies and the Global Working Group on Health Impact Assessment are really committed to trying to kind of identify these mechanisms, identify these lessons and drive forward and maintain the momentum and the, I think that was so well described by many of our speakers today, the knowledge exchange that's really happened across multiple sectors through the COVID pandemic, and the understanding around the interrelationship of public policy making and how that impacts on communities and the distribution of resources across those communities. So we really want to build on that momentum and keep that going. But it does remain a significant task. And I guess what we're hoping for is through the efforts of organisations, global organisations like the International Union of Health Promotion and Education and the WHO itself, that we might be providing the political and technical foundations that will hope that the health promotion and public health community will be able to help build on these skills and keep to drive this forward. And I guess I'd like just to finish and reinforce some of the, I guess, closing comments on what the role of the wellbeing agenda, the movement to a wellbeing society offers, and to pose the question, should we be moving to wellbeing impact assessment, and should we be moving to wellbeing in all policies so that we can be a bit more inclusive and address the sort of notion of health imperialism that's tied in with those terminologies, but without losing some of the ground that we've made. So I'd like just to finish and thank our panelists and our rapporteurs for such a great discussion. And I want to hand back to our colleagues, Marianne, Thierno, and I think David, you'll be there as well, if I understand correctly, for questions from the audience at the live plenary session. And thank you for our pre-recorded session, and I hope you all have a good day.
Many thanks, Carmel and Fiona, for facilitating this pre-recorded panel sessions. And thank you very much to all the panelists and reporters for that very interesting discussions and for sharing their experience on multi-sectoral collaborations during the pandemic. Sorry, we had some technical issues, and unfortunately not all the comments were presented. But let's see if we have some questions and from the audience. I haven't seen right now questions, but some issue has been raised during the panel session, like health imperialism, working with other sectors. I think it's very important to have like political will. Political will is essential. And I think also to have a kind of relationship and credibility with all the actors working together. This is very important. And I guess that the COVID-19 pandemic has shown how it's very important for the health sector to work with the other sectors and to try to find win-win situations. And I think we have to highlight this. And I think also we have to work on building and maintaining trust and you know, between sectors, health sectors and non-health sectors. And we have to try to see how to sustain all these intersectoral approaches that have been used during the COVID pandemic. I think this is a big work for practitioners or researchers, etc. And Liz has highlighted the work that has been done with the public health Wales regarding using health impact assessment on lockdown or a new way of working. This is a type of tool that we can use, you know, to help sectors working together and to try to have a kind of partnership with different actors. There are many challenges, I think, that we are facing and we're gonna face, because as the panelists have said, this is not the last one. We are sure that we have another crisis, and I think we will need like a political support for, you know, trying to work across sectors. We will have also to understand the holistic view or vision of health. That's why we were talking about health imperialism. And one thing that is very important, and I want to add in this discussion, is we have to try to develop a common language, you know, to share language between the health sector and the other health sectors and the other non-health sectors. And the health sector has to change, I think, his mind and know that he's here to try to help other sector attain or achieve their objective. That is very important. And we have to try to avoid like conflict of interest between sectors, and trying to see how we can sustain the approaches that we used during the COVID pandemic, COVID-19 pandemic. This is very important, and this is what I was trying to add to the discussions. And Marianne want to say something. Over to you, Marianne.
Thank you, Thierno, for summarizing those key messages, which are very relevant and useful in thinking about the way forward. I wanted to mention that the Global Network is working with the WHO on supporting a document that the WHO is going to be soon releasing around practical guidance to sustain multi-sectoral collaboration to address social determinants of health, equity, and well-being based on a health in all policies approach. So this document is forthcoming in 2022 and will really provide more practical guidance, building on concepts around multi-sectoral collaboration on health and all policies, but we're really diving into more practical guidance to support actors that are looking to implement such approaches. We did do a webinar last week. The webinar is recorded, is available rather on the Global network, the Global Network for Health in All Policy website. So please feel free to go have a peek. That will give you a kind of a preview of what that document can bring to support multi-sectoral collaboration. Thank you. Over to you, Thierno.
Thank you very much, Marianne. I'm sure that will be a very useful resources, and that's going to help actors to think how to try to sustain this type of intersectoral approaches. And I think it's very important to see how we can help engage sectors into like health in all policies approach or well-being approach. Carmel was talking about well-being in all policies or well-being in well-being impact assessment. We have to ask ourselves, does the problem is the health, the world health, or it is another problem? Do we need to change that word and to have like to using the word well-being? It could be more inclusive, but I think there are other challenges also that we are facing, not only that's why we are using, not only because we are using the word health and instead of well-being or other type of word. I think that we have to think that we really need to have a political support. And that's why during that COVID pandemic crisis, we have a support from the central government, and that was very important in order to implement the intersectoral approaches. And we really need to have that political support from the high level if we want, I think, to implement this type of approaches. And we have to think about that. We need also resources, and Parakou has talked about this. We need communications. It's very important to have a common language to understand the language used by the non-health sector, and the non-health sectors have to understand the language used by the health sectors. And I think to try to define some like common goals or to try to see if we can have like win-win strategies. That's a way that's gonna help trying to sustain these type of approaches. I hope that we're gonna have some publications regarding these issues that we face during the COVID-19 pandemic, and see what researchers can do about this. And I don't know if we have a question right now. Otherwise, I don't want to keep.
We do actually, Thierno, have a question that was submitted by Marie-Hélène Sonnet.
Yeah.
She says, I fear that other sectors will be tired of working with public health actors after this pandemic. How to manage this and get the political will? I think maybe, Thierno, if I can start and you can jump in obviously after.
Yeah,
I think this challenge. Thanks, Diallo.
Mm-hmm.
I think this challenge is real. I think the health sector and the public health sector needs to acknowledge that and discuss with other sectors based on other sectors' priorities, and now not coming in with priorities from the health sector, trying to see to impose, if I can say it like that, their priorities, and be more as a support to advance other sectors' agendas to act on social determinants of health. And the language, as Thierno mentioned, is a key component here, because sectors might not be, well, probably not talking in terms of social determinants of health, but even though they are really having the levers to influence these social determinants. So I think it's acknowledging that people are going to be fed up about public health and health, but still trying to build those relationships to see other sectors' priorities, working with those sectors on priorities, and focus perhaps on easy wins to kind of demonstrate the feasibility of these approaches, the outcomes that these types of approaches can foster, and then build that political will one step at a time, rather going for the big win, which in this context might be even more difficult. So Thierno, I will pass it over to you.
Thank you, Marianne. I don't have something to add about these questions, but I will try maybe to answer the other one from Natalia. She said that related to what you just said on a shared language, can you comment a bit more about the idea of moving to a well-being in all policy, well-being impact assessment in practice and conceptually? That's a big question, Natalia. I hope that I will be able to have, an answer about these questions. What I was saying is that non-health sectors always think that health is only the matter of health sectors. And by using another word like well-being or maybe another word, it's maybe gonna help, trying to bring around the table non-health sector and health sectors, and non-health sector can maybe understand why it is important, to take into account like social determinant of health and health inequalities through well-being. By using the health, the word health, it's mean for some sector like a health imperialism or health is trying, to try to see what they are doing and which type of project they are developing, etc. And maybe that will be a way, to try to avoid that health imperialism. But as we know, it's not easy to handle, to measure the well-being, and there are some discussions about that, and sure we need to think about how we can handle this. But what I can say is we can reflect on the model that has been developed by the Finland, moving from health in all policies to health and well-being in all policies. I think that could be maybe a good example, and maybe we have to try to see how this is working right now in the country. And we have another question from Val. Thank you, Val. Given the high profile of public health through the pandemic and the tiredness factors, do you think it will be strategic for public health to let other sectors lead a well-being agenda? That's my point of view. Maybe Marianne will add also something. I think that they have to work together, Val. I don't think that only the non-health sectors or other sectors have to lead the well-being agenda. I think the health sectors also has to work with the other sectors in trying to lead that agenda. I don't know if Marianne wants to add something.
Yes, Thierno, thank you, Thierno. Maybe my view is a bit different. I think in this context, and maybe even before the COVID-19 pandemic, the health sector gets a lot of public resources, and in a context where other sectors are all kind of working to get more resources, I think it might be strategic for the health to not lead such approaches, and having other sectors lead, for instance, the well-being approach. I think, though, this being said, there is a role for public health to participate in these initiatives in terms of documenting evidence, in terms of impact on well-being, on measurement, on indicators, and so on. So I think public health doesn't need to lead the initiative, but I do think that it's important that public health is at the table in order to be able to provide that skill set to support those actors. So yeah, that's what I would say. Thank you, Val, for that question.
Thank you, Marianne. Still, we have time for more questions. Or if you want to share, some reflections, your experience in intersectoral approaches during the COVID-19 pandemic, please feel free to share your experience. That will be a pleasure. Okay, so maybe then I will do closing remark, because I guess that you have other session also to attend. And thank you very much to all the participants. And we were very happy to have you with us. And we really hope that you really like that sub-plenary sessions, and we look forward to see you again, and to keep pushing through and see how we can really make health in all policy or well-being in all policies, and HIA useful for approaches for planning the post-COVID-19. And so thank you very much, everyone, and yeah, have a nice day, evening, afternoon, depending where you are the planning. And yeah, it has been a pleasure for us to share this experience with you all. Thank you very much.